climate change is one of the important issue which is directly impacting the young child. There are some studies already done, and it has been seen that mostly due to the climate change, the affected will be the young children and the women.
Welcome to this edition of Sustainability Karma. I'm your host, Rajiv Tikku. Today we have a very special guest with us, Chirashree Ghosh. She is National Coordinator of Forces, the Forum for Creches and Childcare Services. Forces focuses on intersecting rights of women, children and labor and raises awareness about issues pertaining to women and children in the informal sector, and also advocates for better policies and their implementation. Welcome, Chirashree Ghosh, to this edition of Sustainability Karma.
Thank you, Rajiv.
How does Union Budget 2025 align with the needs of working parents and young children in India?
Under the Mission Shakti schemes, which the government has promised for 17,000 creches, which is a very good as an policy level interventions, and some of the states had already started it. There are states like Haryana, Telangana, which has already started implementing it. So it is a very good move for the union budget which has come for the young child, for the working parents. And there are budget which has been increased under Saksham Anganwadi, Poshan 2.0. There are other schemes like ICDS, reimagining ICDS. So the budgets are really encouraging for the young children, but we have to see how it is rolled out at the ground level.
Has there been sufficient increase in allocation for ICDS, National Creche Scheme or other childcare support schemes to advance quality early childcare?
Definitely, I think it also depends upon the state intervention, because mostly the schemes are the centrally sponsored scheme, but there are the ratio at where the central and the state both put in the money. There is mostly the schemes are 60-40, 60% central give the budget and 40% come from the state level. So there are progressive states which I was already talking about, Haryana, the southern state like Tamil Nadu, Pondicherry. There are state which has really worked very progressively and put in their additional budget, not only the 40% top on budget for the young child, and there we see that lot of schemes has been rolled out in a very successful way.
Maternity Benefit Amendment Act 2017 was a progressive act that it extended maternity leave from 3 months to 6 months for women in organized sector. How is the implementation going on, and what about the unorganized sector?
2017 was a very progressive thing by the government, which says that the whole maternity benefit will be extended to the 6 months. But most of the companies which we see that they are implementing it, but there was another part where they have talked about the creche provisioning, where they can leave their children within the premises in the workplace and they can work in a very productive way. But if we see in the implementation, there are very few formalized structure where there is a creche provision within the premises. So that is the one thing which we think that we all has to come together and works toward it, because the implementation of the creches are not in the formalized sector, and we know that MBA Act 2017 is only for the formal people. The informal workers are excluded from this benefit. For the informal workers, there are provisioning like Pradhan Mantri Matritva Bandhana Yojana, which talks about 5,000 rupees as cash benefit in a 3 installment, which has been implemented in a widespread areas, and they have really done good. But again, getting those benefits are very difficult, and we know that the identity proof is one of the important bottlenecks for the people, because the migrant people who actually come to the cities, they don't have an identity proof, and for the absence of the identity proof, they are not able to access this program.
Given the gaps in affordable childcare, what are the policy or budgetary measures needed to be introduced to support home-based childcare models, community creches, and employer-supported childcare facilities?
There are 2-3 programs which actually address this need of home-based care. That there is one home-based care for newborn, which we call HBCN program, which is implemented by the health department, and where the ASHA has to do 6 visits to the newborn baby, so that they can see that mortality rate of the child can be reduced. And there is another program, Mother Absolute affection program, which is Ma program, which talk about breastfeeding practices. And beyond that, there is an ICDS program, which it is also named as Saksham Anganwadi and Poshan 2.0. These are the four programs for the home-based and the community-based program. But the employer-run programs, there are 9 laws which talk about the creches. And in that, mainly the Factory Act 1948 talks about the creches. There are Building and Other Construction Worker Act, BOC, BOCWA Act, which 1996, which talk about the creches. And there are Plantation Act, which talks about the creches. But the policy and laws are there, but the implementation is again there is no data available in the national data where we can see that this how many creches are operational in this whole employer run areas.
What can be done to generate this data? Would you have any suggestions?
Yeah, the government can hold an survey, and I think there are a lot of national level statistical surveys going on, and in that, if they can inbuild into that survey, because we know that census survey has taken place 2011. After that, the survey has not been done. So it will be good if government is thinking of new survey and they can inbuild this whole data point within the existing survey. That can then there can be a number how many creches are there at the work site, and if we can come up with that numbers, that how many workers are working and those who need creches, that then the provisioning can be made easily available for them.
The enrollment rate in Anganwadi centers continues to be cause for concern. What can be done to accelerate progress?
I think for the enrollment, there has to be multi-facet involvement. One is that Anganwadi workers has to be free from the other duties, because Anganwadi is a platform of implementation of lot of community-based initiative. So they have to free from other duties. Secondly, I think the community participation can one of the important component inbuilt within the program, so that community can actually support in enrolling the children. For the last mile children could be because they are within the community, they know about it. And third is the whole panchayat's role, if in the rural area, and in the urban areas, ward councillor role can be one of the role where they can actually support in enrolling the children.
The shortage of teachers in pre-primary education is a big issue. What are the easy and doable solutions to address the issue?
I think there is huge vacancy. If we see in the Anganwadi, we see that there is 39% vacancy in CDPO level, at the CDPO level, 34% at the supervisor level, and 12% vacancy at the Anganwadi workers level, and similarly in the teachers also. So we think that immediately that whole vacancies should be filled up, and the government is taking a step towards it, and they are actually vacancies lot of in the Delhi state also. Last year I think a lot of vacancies were uploaded, and people were appointed as Anganwadi workers and supervisors. So the government is taking steps, but it has to be little very fast, so that last mile children are not been left around and their whole holistic development can be ensured.
The new education policy recommended multiple reforms to improve quality of education. What's your understanding?
In the new education policy, it was a very good move where under 3 to 8 years has been included within that whole policy, because earlier it was 6 to 14 years, but in the new education policy 2020 talk about 3 to 8 years, and they talk about 5 plus 3 plus 3 plus 4 model, where they talk 5 up to 5 there should be a whole curriculum of foundational stage, and then there would be the primary, and then pre-primary, primary, and then secondary education. So it is a good move, and it is aligned with the whole program of the, and the major problem I think which is happening, that in that there has 2 model talked about, the dominant model and the whole convergent model, where in some of the states the whole ICDS is actually running within the primary school, and where there is an good infrastructure and other facilities. But there are a lot of Anganwadis, especially in the urban areas, there is a space crunch, and due to the stress crunch, the play activities are not being done with the children. So, new education policy talked about that how the Anganwadi workers could be trained and the primary teachers could be trained for the whole education ECC curriculum. And there are two curriculum which has been developed by the government. One is the whole Navchetna module, which is for the under threes, and Aadhar Shila for 3 to 6, which is a very good move. And if it is implemented in a better spirit, I think that it will be actually solve a lot of problems.
India's progress on SDGs related to children's health is a cause for concern. What should be done to accelerate progress?
Now what the data says that it will not we will be not able to achieve the target, but I think there are a lot of additional budget would be required if we want to address this issue. So budget is one of the important issue if we want to meet the SDG target. Second is the convergence issue, because health, MWCD, women and child development, whole housing, so there are a lot of convergence issues which need to be addressed if we want to address the whole SDG goals. And thirdly, I think there has to be alignment with the whole private sector coming in, CSO partners coming in, and the government coming in together. We have to work as an one entity. If we are working in a different fragmented way, we will be not able to make difference in the life of the children.
While children's issues like health, nutrition, and education will continue to be important, do you think it is also time to factor in newer challenges like climate change and also cybersecurity?
Definitely, I think if we want to work towards holistic development, the climate change is one of the important issue which is directly impacting the young child. There are some studies already done, and it has been seen that mostly due to the climate change, the affected will be the young children and the women. So if we are not integrating in our policies, when we are preparing the policies and integrating these issues within that, we will be not able to meet our target. So I think the other issues like environmental issues, climate change, whole disasters, we have seen that recently how the disasters has really affected in Bangkok. So disaster is coming to be one of the major components. So we have to prepare ourselves, and the children are the most vulnerable because they are dependent on the whole adult caregiver. So if we are not thinking around those lines, we will be not able to address the problem holistically.
How would you sum up the highlights of Delhi Budget 2025?
We are very happy about the Delhi budget which has come up, because the forces has a huge demand, and we have seen that those demand from the local people, from the community, which it has come up, and that has been integrated in the whole Delhi budget. One is the major thing that 21,000 earlier through the Pradhan Mantri Matritva Vandana Yojana, only 5,000 was given to the maternity benefit scheme for the pregnant women. Now it has increased to 21,000, which is I think it a very good start by the Delhi government. Secondly, they have talked about 500 Palna, which is a very good move, and they have additional budget of 50 crores rupees, which is a very good move. Third, which has talked about that whole canteen for the poorer people, that is another very good thing which has happened. And 2,500 for all the women who are below BPL level. So these are the good move by the government. We have to see that how it transform at the ground level, and I think everybody has to put in their effort to make it a reality.
Finally, if you were to imagine the whole ecosystem for childcare services in the country, what would be your ideal wish list?
My ideal wish list will be that the ECD should become a fundamental right for the young child. Unless it is a right, then we no budget or program will be that whole dedicated budget and program will be not formulated. So my vision for young child is it has to be the fundamental rights, additional budget for the children, and I think the a successful and effective implementation of the program where everybody can play a good roles for that, and the every child should get their rights in a better and proper way, so that they can be an whole human capital for India.
Thank you, Chirashree Ghosh. It was wonderful listening to you and the kind of suggestions you made. Thank you very much for your time.
Thank you so much, Rajiv.
Hope you like this program. We look forward to your feedback on our WhatsApp number 9818120554. For participation in this program, write to us at sustainability.karma@gmail.com. Looking forward to meet you again at the same time next week with a new episode and a new guest. Till then, goodbye from all of us. Sustainability Karma, a podcast series on sustainable development, sustainability and ESG.